Hello, everybody. Welcome to this really exciting series, this virtual women's wellness speaker series presented to you by the YMCA and many community partners. I guess we'll get the whole thing started by introducing myself as well as our speakers a little bit, and then I would like to tell you a little bit about where I am and why it is that we're gathering here today. So my name is Jess Posner, and I am the Director of Virtual Programs for the YMCA. I am thrilled to be hosting this event tonight, which is the first in a four-part series focusing on women's wellness. Tonight's guests include the esteemed Dr. Brittany Williams and Dr. Nelly Kazzaz. We will continue meeting every Tuesday in February at the same link and the same time, but with a different pairing of women's wellness experts who will share their expertise and their wisdom with us. This series is presented by the YMCA of Central New York, following up on interest expressed by community residents engaged by Northside UP, St. Joseph's Health, and the many community partners that collaborated in the creation of the new YMCA Northside Women's Wellness Center located at 900 North McBride Street, Syracuse, New York, 13208. The February 2021 YMCA Virtual Women's Wellness Speaker Series will focus on topics at the intersection of women's wellness, health, and wellness topics affecting the Black community and caring for the heart. Our speakers include women medical providers, health professionals, and community wellness experts who have firsthand experience of the transformative potential of building a life of wellness. One of the main reasons that we are convening tonight is to celebrate the opening of the YMCA's new Northside Women's Wellness Center, which is where I'm actually broadcasting from right now, and you can see behind me. Just a little picture of it. Maybe I'll broadcast from a different room each time or something. And so what I'd like to do is we actually just opened like last week to the public and the week before to our members. So I'd like to tell you a little bit about the center and how it came to be. The project began with Center State CEO through its Northside UP program, which facilitated a community collaborative to design, develop, and launch the Northside YMCA Women's Wellness Center. First imagined in 2013 during a series of community engagement meetings facilitated by Northside UP and St. Joseph's Health, the new center offers a safe and culturally welcoming space for women from the North Side and greater Syracuse area to exercise, access community resources, and connect with neighbors. It offers short-term child watching services, which allows women the opportunity to focus on their health and well-being while in the space. The entire project was designed through a diverse cross-section of Northside residents and community partners who directly informed program design, project location and architectural design, business models, partner identification, and fundraising. Northside UP also helped to secure the project site, led the effort to raise $1.5 million in funds for construction and operating costs, and recruited the YMCA to become the owner and operator of the center. Working together, the YMCA, community residents, and other stakeholder partners are helping to ensure the center continues to be welcoming to all women of all cultures, abilities, and socioeconomic backgrounds. If you'd like to schedule a tour or a visit, you can visit a website, which I'll read to you, but you can also just email me. My email address is virtual@ymcacny.org. It's also in all the forms you use to access this, so go ahead and reach out to me and I'll be happy to give any of this to you. But if you'd like to schedule a visit, you can visit www.ycny.org/Northside bookings, or you can join online at ycny.org. And through the end of February, we are waiving all joining fees. So if you're not currently a member of the YMCA, but you would like to, if you join using the special promo code Northside WWC for Northside Women's Wellness Center, that joining fee will be waived for you. I want to shout out a thank you to our project partners who include Northside UP, obviously the YMCA, TCI Syracuse, St. Joseph's Health, Center State CEO and Northside UP, MS Hall and Associates, the Northside Residents, Hope Print, Northside Learning Center, Assumption Church, NADA, Syracuse Northeast Community Center, Syracuse University Learner Center for Public Health Promotion, Healthy Connections, YMCA of Central New York, ECHO, Seon Lee, and Zoriana Dunham, with additional financial support from CNY Care Collaborative, Nazareth Fund, Mother Cabrini Health Foundation, and Healthy Connections. So like I said, if you have any questions about the center or any of this, please feel free to email me at virtual@ymcacny.org, and I'm happy to do my best to answer any of your questions or also connect you to the person who can. All right, so now that we've gotten a little bit down about where we are and why we are together, I'm gonna articulate how we're gonna be together. So the way that the format of tonight is going to go is that each of our speakers, first Dr. Brittany Williams and then Dr. Nelly Kazzaz, will speak for 20 to 25 minutes apiece. When Dr. Brittany Williams, who will go first, is finished, we'll transition to Dr. Nelly Kazzaz, who will speak next. Following both of their presentations, we'll have a joint Q&A session. So if you have any questions, please hold them until the end of the presentation, and then you can type them in the chat. I will be moderating the chat for those questions, and then we'll read them aloud to do my best to moderate a conversation between your questions and both of our guests tonight. So does anyone have any questions around any of that so far? All right, cool. So without further ado, I would love to introduce to you Dr. Brittany Williams, who I am going to spotlight for you all. All right, and I'm going to read her bio now to do a little nice introduction. All right. Dr. Brittany Williams is a visiting assistant professor in counseling at Syracuse University. She earned her doctoral degree in counseling and supervision at James Madison University's CACREP accredited counseling and supervision program, and an MS in clinical mental health counseling with a certificate of advanced study in child therapy from Syracuse University. During her graduate studies at Syracuse University, she worked as a student advocate at an inner city high school, a teaching assistant at an urban elementary school, a counselor aide at a women's substance use community residence, and a housing specialist for individuals with a disability who are considered chronically homeless in Syracuse, New York. Dr. Williams is invested in fostering alternative environments to assist people with mental health concerns and who have had traumatic life experiences. Brittany focuses on the quality, life-changing therapeutic experiences and believes in meeting people where they are in order to provide them with the support and tools necessary to live a life of wellness. Dr. Williams identifies as a humanistic counselor and believes in the client's ability to be active in their therapy and works with them to facilitate a change. Brittany is invested in culturally sensitive counseling practices and understanding individuals who are impacted by social, psychological, and cultural factors of racial and ethnic disparities in mental health treatment. She is committed to fostering positive outcomes among marginalized populations and particularly within the Black community. Brittany's compassion, empathy, and individualized care can assure any client she serves that they are not alone in their life-changing experience. Her goal is to support individuals and assist them to thrive through many life circumstances. Thank you so much for joining us, Dr. Williams. I'm going to hand things off to you.
Thank you. All right. I am going to attempt to share my screen, and I hope it goes how I planned. But I want to thank you all for joining us this evening. And I think I'm just going to jump right in. Let me see if I can. Oops, that's not what I wanted to do. Okay. So I want to just get started. My hope for this evening is that you can walk away with some gems on how to improve your mental wellness. So I want to do a check-in first and just hear from you all in the chat, if you could. Just type what words maybe you associate with mental health and wellness. And Jess, if you could assist with the chat. Not seeing anything pop into the chat, which is okay. But if you think of things as we go along, I want to be able to have this presentation be, I guess, as engaging as possible. So feel free to drop any thoughts or feelings that may come to mind as we go along.
Dr. Williams, I didn't mean to interrupt you, but for some reason they're all coming as direct messages to me, but I'm happy to read off a few of them.
Okay, cool.
Okay, cool. So we've got boundaries, mindfulness, misunderstanding, balance, need for support, community, stress, focus, meditation, crazy. The chat is set up to only go to me. While you talk, I'm gonna try to figure that out. If anyone knows, feel free to message me. And good relationships, recovery, harmony, stress relief.
Awesome. These are awesome, awesome words, and they're right on target with what I'd like to talk about today. Thank you, Jess, for helping me out. So I'll start with the basics. When we're talking about mental health, it is a person's condition regarding their psychological and emotional well-being. And so I believe this conversation is really important because the mind is equally as important as every other organ in your body. We want to have healthy minds in the same way that we want healthy hearts, liver, kidneys, etc. And so we all go through difficult times, such as loss or trauma. Stress is a huge factor on our mental wellness. And there's biological factors, family history, and physical conditions that can also impact your mental health. So as we know, there are definitely two big contributing factors that we've seen at the start of 2020 and it's carrying over now even into 2021. COVID-19 and the racial unrest in America are two major contributors to mental wellness. So today I want to talk about how that affects, both of those affect Black women's mental health and well-being. So I'll start with COVID-19. The pandemic really has done a number on us. Aside from the physical health symptoms that people are experiencing, individuals are also dealing with bereavement, loss of loved ones, isolation, loss of income, fear of the unknown, which really I think is impacting these increased levels of alcohol and drug use. We're seeing lots of loss of sleep, appetite. Maybe folks are overindulging. There's inattention and this inability to maybe complete larger tasks. And so as a result of that, we're seeing a rise in anxiety and depression. Race-based trauma is also a result of the racial unrest that Black Americans face in day to day. It's defined as an individual's personal exposure to racism that causes emotional stress, physical harm, and or fear. And race-based trauma develops out of racial inequalities and disparities, which can be at the heart for mass trauma in the Black community. And so we've seen evidence of racial inequalities, such as the overrepresentation of Black Americans in the criminal justice system, AKA mass incarceration, Blacks being shot and killed by the police. We always want to be able to say their names: George Floyd, Breonna Taylor, Daniel Prude, and this is an inappropriately long list. We have racial gaps in employment, just to name a few. The systemic oppression and discrimination are often at the core of many traumas that Black Americans experience. And so due to the shootings, not only do Black Americans experience grief, loss, and sorrow, there's also this intense feeling of injustice that continues to reflect the history of oppression and discrimination and contributes to this larger community losing hope and trust in any group outside of their own. So Black Americans begin to organize themselves around the harmfulness of trauma in an effort to prevent injury in the future, and then cope with this harsh reality that the trauma presents. So I want to narrow our focus onto Black women for a moment here. And as a direct result of slavery, we have seen the dissolve of the Black family. This has now contributed to Black women being the matriarchs. Black women have always had to be everything for everybody. We hear about the strong Black woman syndrome, if you will, and this perception and view of Black women that they literally can hold the weight of the world on their shoulders. So to compound whatever a Black woman may be dealing with in general, now we have to compound that with the weight of the family that she may care for, the son that she may have to be worried about and afraid for, the daughter that she has to protect, so on and so forth. And so we see that Black mothers are still raising their sons to be afraid of police, to be afraid of people outside of their own community, and teaching their sons to keep your head down and do what you need to do. This has now become an aspect of self-preservation. When we think of just how long-standing the effects of slavery has been, we can begin to think about it from the term of intergenerational trauma or epigenetics. And I didn't include a slide on this. I didn't want to get too deep in the weeds with things, but I think it's really important to highlight that your genes can hold memory. And so we can see how the environment can influence our genes and supports the fact that trauma can be transmitted from generation to generation. A significant enough trauma or a life-threatening event can alter one's genetic coding, and this can be passed down for several generations. And so a lot of times what we may have seen in the past as a survival technique or survival mechanism has now become maybe a hindrance to someone's success rather than really helping. So race-based traumatic stress can really manifest in psychological symptoms such as emotional numbness, anxiety and depression, as I mentioned before, intrusive thoughts or nightmares, and this mental exhaustion. It also can manifest in some of the physiological symptoms that we see such as like disrupted sleep patterns, a lack of appetite, body aches and migraines, the self-destructive behavior, maybe overindulging in drug use or alcohol use. And then again, this hypervigilance, really wanting to make a safe space for yourself and your loved ones. And so it's really important to understand that mind-body connection, which is essential for healing, which we'll kind of get into next. So resilience, I'm going to try the chat again. When you think of resilience, what comes to mind? What words do you associate with resilience? Let's see. So yeah, persistence, overcomer, bouncing back. I like that. Adapting to changes, struggle, strength. So we see some of those positive and negative aspects of resilience, which really holds the concept of what resilience is. It's this ability to maintain that emotional and physical well-being in the face of trauma. And it helps to not only anticipate and prepare for negative life events, but to persist in the face of adversity. So that comeback strength, growth, being able to adapt, all of those I think are really great synonyms for resilience. And Black Americans have been very resilient over the course of our time in America. So I want to get into the helpful tools and tricks. because this is the focus. While we know that COVID-19 and the racial unrest in America has really weighed heavy on a lot of us, I think it's important that we acknowledge that and also walk away with some tips to cultivate self-care during these really uncharted times. So I'm going to share with you 5 tips in these next few slides and talk a little bit about how we can maybe concretely work through engaging with ourself in a healthy relationship. So the first one is finding your communities of support. Having a social support network is really important in our role of coping and how we get through and manage day-to-day stressors, as well as everything that can be compounded. So typically, we can cultivate this through relationships that we may have with family members, and that can be immediate or extended. It can also be, I can't think of the cute like colloquialism around friends that have become family, but those can be also relationships that you've built. Maybe you have a house of worship or a community that you would engage with. That is also a way to kind of find that sense of support. And this can help really decrease and alleviate some of the exhaustion, mental exhaustion that one may be experiencing during these times. I need to keep the chat open so I know. Yes. So family is a big one. Family, yes. And then the second one is taking that time to disconnect. We want to be able to, I know that it may be helpful to keep up to date with the news and things that may be going on, but sometimes too much exposure can be overwhelming. And we have literally the access to the media at our fingertips. You can Google it on your phone or your tablet. The news comes on at, I don't even know, 6 in the morning, 7 a.m., 8 a.m., noon, 5, 6. So it's just always, we can be inundated with information. And so we want to be able to find ways to stay connected without becoming overwhelmed. And so maybe it's setting a timer where you put your phone away or your tablet away and you disconnect. You don't engage with the media, and then come back until you can tolerate it again, but finding whatever that balance may be for you. Making your mental health a priority. Physical health is important, and we know that, but sometimes it can be prioritized over our mental health. But your mental health is equally as important. We want to think holistically about our wellness, and so taking time to prioritize your mental health and do what seems fitting for you. Maybe that means connecting with a therapist or finding a provider, a safe place, brave space for you to engage and unpack a lot of the mental and emotional feelings you may have. But also maintaining your physical health. And so a way to do that is to get active, get outside. Maybe you enjoy some long walks or hikes, but exercise and that physical activity, again, the mind and body is connected, and it can help really increase those feel-good hormones, which can improve your mood and help to manage your stress. And last but not least, we want to find our way to advocate. I think advocacy is really important, and some people can be on the front lines and others may do better one-on-one. But if you have a really great skill or a resource, put your talents to use to continue to raise awareness and to spread the word about whatever it is that you may be passionate about. And so if that's mental health and wellness, I invite you to advocate on that. If it's women's rights, Black women's rights, trans women's rights, just advocate, get that awareness out there. But do it in a way that feels natural and comfortable for you. So last thing, what are some self-care activities you can enjoy? Those are more big pictures, but maybe we can talk a little bit about maybe some prayer or meditation cards, or if you have a journal that you like to write in, maybe you can have a guided journal. Talking with a friend. I'm interested to hear or see, I guess, in the chat, what are some activities that maybe other folks enjoy that we can kind of create a resource we can share amongst everyone who's on the Zoom call now to kind of gather some of these resources. Ooh, cooking is a good one. Yes. There's something really soothing around preparing a meal, especially when it's made with love. Gardening. Yes, my mom and my grandmother, they're big gardeners. Cleaning, horseback riding, painting. These are great. Ooh, stepping out of my comfort zone. Okay. Yes, the snow in the park is definitely a lot. Reading, yoga, meditation, warm baths, snowshoeing. I love this. So a lot of the suggestions that people are putting in the chat, they not only can be done alone, they can be done with people as well. And so we're finding creative ways to engage now in this time where we have to socially distance appropriately and wear our masks, but there's Zoom yoga and maybe some outdoor winter activities. You can socially distance, Zoom parties, yep, taking long walks. Yeah. Ooh, and a Zoom salsa class. That sounds like fun. So I want to leave you all with some resources. This is really, it's not an exhaustive list, but it is a list of some Black therapists in Syracuse. And so if you find yourself needing a support person, I challenge you to reach out to one of the many therapists that are available on this list that can help you. And I think that's all I have. I wanted to be mindful of my time, so. Wonderful.
I did DJ MC over here. I thank you. Ooh, sorry, hold on one second. All right, I'm going to add you back. Thank you so much for that. That was such an informative and caring and really wonderful presentation, giving us such a helpful foundation of understanding and framework, and then also some, spot on recommendations for how we can, today, begin to really start focusing on our mental well-being during this really challenging time.
Yes.
So thank you so much. And I just wanted to say that we are going to come back and have an opportunity to chat with Dr. Williams following Dr. Kazzaz's presentation. And so if you have any questions specifically for Dr. Williams, feel free to throw those in the chat right now while I'm introducing Dr. Kazzaz. I will paste them over into a different document, and then I will do my best to moderate that conversation, quoting who those folks are if we'd like to have a bit of a dialogue with one another. So thank you so much, Dr. Williams, and we look forward to connecting with you in a few more minutes.
Absolutely. Thank you.
Okay. All right. So I would now love to introduce you all to Dr. Nelly Kazzaz, who should be highlighted for all of you right next to me right now in the Zoom. It's so amazing, all this technology. They've made a lot of updates recently that you can kind of like really DJ with them. So without further ado, I'd like to present to you Dr. Nelly Kazzaz, who is a cardiologist at St. Joe's Health Cardiology Associates. Born and raised in Amman, Jordan, she received a full scholarship to the University of Jordan Medical School and graduated in 1995. She then came to the United States to pursue her dreams and complete her education by becoming a cardiologist. In 2004, when she had completed all the training in specialties and subspecialties, she moved to Central New York and began her first private practice position. She has lived in and loved this area ever since then, and today she is a passionate medical leader and advocate for her patients' health with tireless emphasis on preventive care. With plans to pursue her MBA, I believe it's already underway, and
Yes, I know.
currently pursuing her MBA. She believes that if you passionately believe in the need for change, then you must be an instrumental part of it. She is a strong advocate for other young women aspiring to pursue careers in science. So without further ado, I present to you Dr. Nelly Kazzaz.
Thank you. I would like to thank the YMCA for this opportunity and Dr. Williams for a wonderful talk and a segue to my talk this evening. I can't tell you how excited I get when I get a chance to talk to a group of people about heart disease, and particularly women and heart disease. It gives me an opportunity for my message to reach out way beyond what I can do when I talk to one patient or one family member. While most women live to fear breast cancer, most of us will die from heart disease. It actually, women die from heart disease more than combined of all cancers, respiratory disease, and Alzheimer. Of course, I don't like to always emphasize on the bad news. The best news is 80% of heart disease is preventable. There are a couple of things we cannot change, and the fact that we get older and our risk of heart disease and other diseases will increase. The other thing is our genetic predisposition, which is the family history. But everything else can be controlled by environmental changes and medical changes and interventions. Most important message I like to get out is knowing our numbers. Most of the patients I see, they always tell me that their blood pressure is okay, but they don't know what their blood pressure is. They think they don't have diabetes, or they have diabetes, but they're not aware of their number. They don't believe that they have high cholesterol, or they don't realize what their parents or uncles or grandparents died from. So these are the things that are so critical to know and to pass it on to our children, because that what will affect their risk of heart disease in the future. So if there is one message that I can give today, is for each one of us to go to their primary care and ask, what is my blood pressure? What is my total cholesterol? When was the last time I had it checked? So that you can realize what your numbers are and where you stand on the risk for heart disease. The second thing that is very important for us as women is to realize that heart disease is a woman disease, despite the fact that I belong to the American Heart Association and I'm a strong advocate for them. I'm on their board of directors. And the funniest thing I see, in the early 70s and late 60s, the only thing that they talk to women about is how to care for their husbands with heart disease. That was how it was mentioned. And it might seem long ago for our young kids, but the 60s and the 70s were just yesterday for most of us. And so we came a long way being aware that heart disease is an instrumental part of women health. And unfortunately, more women die after presenting with heart attacks within the first 30 days after heart attacks than men do. And it has a lot to do with late presentation, the bias in us as medical professionals and recognizing women with heart disease. And most importantly, most women, even though some of us will present with chest pain, most of us will present with an unusual symptoms, as simple as fatigue, as confusing as a nausea. A lot of women will present with jaw pain, which, they seek help and care through their dentist or other avenues. So what I would ask of each and every woman of us is to make sure that the professionals are the ones that make these decisions. we will never mind if a patient come and it turn out to be a false alarm or something minor. But unless we risk stratify you, where your blood pressure is, where your cholesterol is, where your weight, what your family history, what kind of symptoms you have, and proceed with non-invasive or invasive testing based on your presentation, and then decide that it wasn't cardiac, and then send you to someone else to address these other symptoms, including possibly gallbladder or ulcer disease or other things, then let the professionals decide. The one more thing that I like to emphasize on is heart disease look like all of us. It comes in all sizes, shapes, ages. We all look like heart disease, and heart disease look all of us, no matter how young or younger we are, what size of dress, because again, most important factors can be unpreventable and can be inherited. Stress is a very instrumental part, particularly in the last year, as Dr. Williams had emphasized. Stress and stress management is extremely important. Not only that it increase our blood pressure, increase cortisol levels that can lead to increased blood sugar, increased cholesterol, reduce our ability to move, our ability to concentrate on our self-care. It actually definitely has a correlation with increased risk of what we call it plaque rupture, which lead to the acute heart attacks. So I think women were more affected by the current pandemic because of the roles that we have in our families. If we're working mothers, wives, daughters of elderly or sick parents, but also because we're naturally more social being. We depend on that cup of coffee with a friend or with a colleague, with a coworker. It makes the world of difference in our mental health, ability to relax, reducing our blood pressure. We depend even on exercise. We really depend on a friend to take that walk with us or go to the YMCA to exercise for that day. So I think we were exceptionally affected. And one of the problems that we have as women, we say it's on everyone. I can't complain. It's okay to grieve. Yes, it is a global pandemic. I tell even my 14-year-old, yes, you're right. It's on everyone. You're not the only one that's staying home, cannot see your friends, but it's okay to grieve. It's okay to talk about it. And I have to say, one of the things that I dislike about the pandemic was the social distancing. I say physically distance and social connectivity and social connections. We should be more socially connected. I was thinking today, if it wasn't for the pandemic, this event will be canceled because we would have to drive and we couldn't drive. So it actually, as sad as this part of our life had been, and we were able to be more connected. I was able to Zoom with friends that live thousands of miles away, because in normal time, I won't be able to on a weekend or during a holiday because I'll be busy with other things. So what I would like to address is physical activities and healthy eating. I can't emphasize enough how much environmental factors can be helpful. They're not always adequate to reduce our cholesterol to the desired levels. They're not always adequate to reduce our blood pressure to adequate levels, but definitely they're the first measure that we recommend, and they can make huge differences. Some studies had showed that eating certain food that high in good fat, like avocados, can reduce your bad cholesterol by 13 points. Some of the medicines I give cannot achieve that 13 points. Obviously, some of us will need a lot more than 13 points, but I really need to emphasize on reducing animal fat, like red meat, dairy products, fried food. Shellfish is one of these foods that high in cholesterol that people think of as possibly fish and healthy. Unfortunately, it's not. And emphasize on good fat, including olive oil, avocados, oatmeal, tree nuts like pistachios, walnuts, and definitely white fish like and salmon. They're good for your cholesterol. Regarding hypertension, main problem is processed food, high salt intake, and definitely stress. Is actually meditation and relaxation methods are one of the proven factors and health ways to reduce your blood pressure up to 10 points if it's practiced routinely. Regarding health activities, when my patients come to me and they want to run a marathon or be part of one of these Ironman competition, I say it's great, good for you. But really, when it comes to your heart, you don't have to be. For heart health, you don't have to carry heavy weights. You don't have to run marathons. I'm not saying don't, but all what you need is to increase your heart rate for 30 minutes up to 5 times a week. And it can be brisk walking. It can be walking on a treadmill in this situation, walking on stationary bikes for people with knee problems, hip problems. Hopefully when life go back to normal at the YMCA, swimming is a great way of increasing your heart rate without causing a lot of stress on your joints. Again, for people with arthritis or knee problems, hip problems. And obviously, what matters is not our dress size. What matters is our health. You know, always I get asked, what should I weigh? What dress size? That's not, we come in all shapes and sizes, but what matters is our health. And my major advice is, imagine when you're carrying 10 pounds of grocery and you go up your stairs or get out of your car. It's a lot harder than when you put your 10 pounds down. And 10 pounds might seem not to be a lot, but it makes a huge difference. Imagine carrying your grocery to bed, to shower, to while you're cooking, while you're walking. It makes a huge difference. All diets work, but extreme diets work for short periods of time. What I like is minor changes that can go a long way and you can maintain that weight loss. I recommend to lose about a half a pound a week by making a very minor change in your daily routine without changing everything, without being consumed by your diet. Just making a small change every week and add a new change to it the next week, and then it becomes a habit. They say it takes about 60 to 62 days to form a habit. So if we do that and we lose half a pound a week, we might lose 26 pounds a year. But most importantly is we can keep it off rather than make these dramatic changes that we cannot live by and gain that weight back. So to summarize, my message to you, my plea to you is don't ignore your symptoms. Let us decide. You know, I promise we never punish somebody for coming with a symptom that turned out to be minor or non-cardiac. Second thing, please know your numbers. Please have a primary care. Please ask them, what is your blood pressure? What is supposed to be? What is my cholesterol? What is supposed to be? Have a conversation with your family. Unfortunately, a lot of cultural, differences that people don't talk about their disease. It's not okay to have hypertension, as if it's a taboo to have high cholesterol or diabetes. But ask your family members, ask about the history. What did Uncle Joe died from? What did Grandma had before she died? It's extremely important to know your risk. Make sure you eat healthy, make choices, make small changes that you can live by and maintain that weight loss or lifestyle change that you make, and move if you can. And remember that your mental health that Dr. Williams had talked about, it is so instrumental in your physical health. They go hand in hand. We're one people. And remember, physical distancing and not social distancing. We're in this for the long run. We don't know how long it will go. We need our friends, we need our families, we need our neighbors. Make a connection, find a way. Thank you so much. And please don't hesitate to contact me. I do work for SGH Cardiology. There's amazing cardiologists in this town. If you prefer to see a woman, if you prefer to see a man, if you prefer to see, we have them in all genders and colors and shapes. My office number is 448-6215. You can find me on St. Joseph Hospital website, on SGH Cardiology website. And I would love to have any questions today, and I would love to see any of you that have any concerns about their cardiac health. Thank you again for the opportunity.
Thank you. I just wanted to thank you on behalf of the YMCA for your generosity, for sharing with us, and for really giving us some really helpful resources and the inspiration to make small changes that we can maintain over the course of a lifetime. Because I think that especially under these stressful times, it can be so daunting to imagine changing your life when day to day is such a challenge, right? So to imagine those small incremental steps that you can build over the course of a lifetime is something that I find quite motivational, and I think also accessible to many people. So thank you for that, and for so many other things that you offered us.
You're welcome.
So at this point, as your MC, what I'm going to do is I am going to actually also spotlight Dr. Williams. And I'm going to, I think, probably remove myself, but while I'm still talking, I'll keep myself up. And what I'd like to do is I'd like to invite anybody to put questions for Dr. Kazzaz, for Dr. Williams, for both of them into the chat. If you would like to specify to one or the other, you may do so. Otherwise, we can ask them to both of our guests. While those come in, we have a few from earlier that I have to ask, but I also just wanted to respond to a couple requests that people put in the chat. So we did have a request for the membership information. So I'm just going to paste that here to everybody if you would like to take a look at that. I also want to make a plug for the YMCA. We are open. We are, sort of out of the zones, and we do have pools that are open. We have gyms that are open. You do need to make a reservation for them, but you are able to come in and use the facilities. We are limited in numbers, but we are here for you, and you are able to access them. I also want to make a quick plug for the virtual Y, which we have been launching recently. And we have some really incredible resources there, both live fitness classes, we have on-demand fitness videos. We also have events like this, as well as member meetups for folks that are members of the Y, and some really exciting things going on. So please do enter your questions into the chat. One of the first ones that I would like to ask is from Toby Sheck. And they asked it first for Dr. Williams, but I'd actually love for both of you to respond. And the question is, I often find that taking care of myself means setting boundaries and limits and saying no. How can I be okay with this when I feel like others think I'm being selfish?
Yeah, I thought that was a really awesome question. I think oftentimes we can find it hard to not want to please others. And for whatever reason, it can be challenging to say no. But I think there's some little tricks and wiggle room to get around saying no. But while also becoming more in tune and listening to what you need and what you want and that smaller voice. And so two of my faves when I may want to say no, but I'm really considerate of others' feelings or how this may impact them, I will say either let me think about that or let me get back to you. And that allows some time for me to, I guess, really confirm that I want to say no. But also, it relieves some of that pressure of feeling like you may be being selfish, or that may be the perception. But it is absolutely important to set boundaries and to be able to say, this does not serve me, or this is not something that I'm willing to do or engage with, and saying no. So there's ways to say no, but no is also a complete sentence.
Thank you so much, Dr. Williams. Dr. Kazzaz, would you like to respond to that as well in terms of tips for prioritizing the self when perhaps you've been raised or to, not?
It is, unfortunately, it is harder for women to say no. And it's difficult for me even to give advice because I struggle with that. I read books. I attend the lectures and conferences about how to be able to set your boundaries to be able to proceed. But I also find it, as Dr. Williams mentioned, it's important to give yourself time. In my profession, I also suggest other possibilities, especially when colleagues are always asking me for more. I suggest that maybe X or Y will be more than willing to do it when I can. And in my personal life, I try to include my family in the care for myself to feel less guilty about separating from them. Or if I want to take a walk, maybe we'd take a walk together. If I want to cook healthy because I'm on a health track, maybe we should all do it. And I think it will make it easier for women to concentrate on their self without feeling like they say no to eating, the piece of cake or the pasta dinner tonight or something like that, and make it like a group effort to be healthy, especially with teenagers at home.
Speaking of teenagers, we have a question that came in, and I'm not sure if this is a two-part question or not, but I'm going to pose it as this way. From Lisa Dunn Alford, we have the question for Dr. Williams, that I'd like to hear some suggestions on what we can do to help children handle their emotions during the pandemic and stay-at-home requirements. I'd also like to extend that to include teenage girls.
Okay, that's a hard one. My experience with children is somewhat limited, and unfortunately, most of what I would suggest you can't really do. But I do think that if there's appropriate ways that we can physically distance, but allow children to engage socially, I think would be appropriate. Um, Even as Dr. Kazzaz said earlier, like, we are social beings, we need that stimulation from others. And so, especially for children, they need to have that ability to be outside and engage. I know that there's also some like helpful uh, online resources. I'll have to try and pull them, but helping children manage their emotions, we can do kind of some mindfulness activities. I know when I was working with little ones, um, even having them practice yoga poses that are funny or fun, and we can nickname them, like a tree pose, can engage a child and help them to settle in and regulate their emotions. Some breathing techniques, counting, and having them count while they're trying to be mindful of their breaths. Count how many breaths you're taking. Those are really helpful for managing some of the anxious feelings that, kids may be having. Teenage girls, that's a tough terrain just in general. But I think some of the suggestions can still apply, really doing some mindful breathing and anything that can kind of regulate the heart as well as the mind, I think would be helpful for children and teenagers.
Thank you so much. Dr. Kazzaz, I have a question for you from Leah Rizzo. She writes, I've found that for many people who suffer from heart disease or contributing conditions like diabetes, finances and insurance are both enormous obstacles, especially now when so many people are dealing with unemployment or other enormous life changes. How can healthcare providers best assist people who are looking to improve their healthcare but do not have the appropriate resources?
Thank you. Thank you for this question. As Jess mentioned at the beginning, I've been thinking about going to my Master of Business Administration for quite some time, and it did take a pandemic to push me that I have to do this. And that's one of the biggest reasons. And as a segue to answer this question, I would like to mention back in March when healthcare professionals were called heroes, a lot of hospitals had furloughed about 50% of their nurses. They had reduced their physician pay by 20%. And, to me, that was shocking because these are the ones that we're relying on to save us or get us through this difficult time. But it was business decisions made by, unfortunately, people that are not directly involved in the care. And that also was my concern about the people that were on unemployment, because a lot of people felt comfortable by the amount of money that the government was providing for extra. But we as a society did not realize that none of this money is enough for one hospitalization, or actually a couple of expensive non-invasive testing, even those whatever $600, I don't know the details of the exact amount. So it made me personally felt uneasy about what's going on when it is a healthcare disaster. And it seemed like healthcare and healthcare professionals and people with illnesses were suffering the most. And I felt like there has to be a business model, a business change that will understand that. The other bigger problem was I had patients with chest pains for weeks, and they were scared of the virus and they wouldn't go to the hospital. Like, we forgot to emphasize that pandemic does not mean that other diseases will take a break. They were still happening. People were still having appendicitis and gallbladder and heart attacks and strokes. So I wish I have the answer for this, but I know that it's a big problem. And unfortunately, when we have all these stimulus money or all these decisions that are made in big hospitals or big healthcare centers, that this is not taken into consideration. I have to say, no matter how you feel about the current economic or political status, it's wonderful country. If you come to the emergency room, I will take care of you, and I will never ask you if you have healthcare insurance. I promise, and most of my colleagues will. Please don't ignore your healthcare. Do not ignore taking your medicine. We have so many resources. If you call the office and say, I cannot buy my medicine, we have so many ways to help you, but I can never tell if you don't call me and let me know. And that applies to your actual physicians. I know it's more expensive to eat healthy, but there are always ways around it. If you cannot afford fresh vegetables, fresh frozen are so cheap and so healthy. Don't go for cans. Definitely avoid cans. But fresh frozen, they can be 99 cents or be 2 for 1 and be as healthy. Just be resourceful, be creative about finding healthier choices to eat. I fully understand it's very, very expensive to eat fresh fruits. They might be not, or vegetables, they might not be available where we live. All these problems, but that will not substitute for taking your medicines and seeing your doctors and seek medical help in case of emergencies. And again, it's still a great country. We still committed to helping people first and foremost. Whatever happened later, there are so many ways that it can be addressed. It can be right off. It can be, we can get you samples to get you through this difficult time. We can have you connect certain resources in the New York Health Department. Again, reach for help, and we promise to help. We're in this all together. We all struggling. We're all carrying different sizes of crosses. And I think everybody, every doctor office, every mental health doctor office, they're willing to help. And the last thing we'll ask is, what kind of insurance? Do you still have a job? Sorry for the long answer of a short question.
No, thank you. It was inspiring. And I think also really helpful to hear that by asking for help, you may identify that there are resources that you do not know, right?
Absolutely.
So the idea being that, like, I need this thing, can you help me? Even if you don't know what the answer is, the professional that you may be searching most certainly knows more than you may, right? In terms of access to those resources. So that's something that I think is helpful to remember. And so thank you very much. Dr. Williams, would you like to answer that same question with respect to mental illness?
Sure. So two things that came to mind while Dr. Kazzaz was speaking. I think resources and access is a big thing. And one thing that I think a benefit that has resulted from the pandemic, a lot of therapy resources are now available online. And so you can get connected with a provider even through a virtual online platform. And you can also find a lot of tips and tricks on social media, as well as just a good old Google search. But I also recognize that there is a financial component to seeking mental health services, and that's a huge barrier. It's aside from the stigma and the whatever personal experiences people may have or thoughts they may have regarding seeking mental health services, but finances are also a barrier to seeking any type of treatment. And similar to the advice that's already been shared, if you ask, there are lots of therapists that will provide either pro bono work, or they offer their services on a sliding scale. And so it's really about having a conversation with the provider you'd like to get connected with, and they'll do their best to be able to work within whatever financial confines you may have.
Thank you so much. If anyone has any other questions, please go ahead and enter them into the chat. I actually have a question for both of you, which, perhaps you can take turns answering. Both of you spoke to the importance of beginning to meditate or meditative practices as something that can be helpful for both mental and physical health in really significant ways. So I was wondering if perhaps from your own perspectives, if you could give some advice on a beginner on how to start meditating or how to start identifying meditative practices and the variety of what that might look like.
Go ahead, Dr. Williams.
Okay, thank you. So
Please.
there's a lot of apps now. Down Dog comes to mind and Calm comes to mind. And those two, an Insight Timer, don't let me forget that one either. So those three, I think, are kind of top choices that people can use. The beautiful thing about all of those is you can gauge how long you want to do a meditative practice. So I think for beginners, it might be easy to start off with about 5 minutes and work up to 10, work up to 15, and so on and so forth. But it allows you just a dedicated time and space to settle in and really start to be mindful of your mind, body, spirit, and all how it all connects. But yes, so someone said in the chat, Insight Timer, that's one of my faves. And you can pick from a variety. So personally, I get caught up in how the person may sound. And if it's not this like soothing voice for me, then I want to change it. And the beauty of these apps, you can pick from thousands of either guided meditations or even just a calm, soothing sound to just settle into. So there can be waterfalls or rain chimes, anything you can think of. They've got all these different sounds that you can listen to. And I say start small. Start with maybe even 2 minutes. If this is something you've never done before, it might be helpful to start small and work your way up. So those are my thoughts.
Thank you so much, Dr. Williams. Dr. Kazzaz, do you have any ideas on meditation? Or even I was thinking about like small dietary changes, speaking to any apps or any supports that are easy to access for beginners.
I don't have any suggestions regarding app. I just like accountability. That's why I used to highly recommend Weight Watcher, just because when we report to someone, we're more likely to stick to it. And that's why if we take a walk with a friend, we're more likely to go on the walk. But diets in general, the Mediterranean diet had been proven again and again to be the best choice for cardiac health and reduced risk of cardiovascular events. The other book that I recommend is the South Beach Diet. It's actually written by a cardiologist, and it was written for heart patients to lose the weight before their open heart surgery, to make sure that their recovery improve by controlling their blood sugars and cholesterol levels and weight, and reducing the risk of infections. It is very scientifically based. It emphasizes on good fat and good carbs, and avoiding bad fat and bad carbs. So it is a lifestyle change. I always say you've got to read the book and not just follow the recipes or the diet, because it changed the way you think about food, because it tells you that if you eat your piece of chicken at dinner and then you eat your piece of bread, your body responds completely different than if you ate that same piece of bread first and then you ate your piece of chicken, because it changed the way your insulin levels increase. If there is a protein in your stomach, then the absorption of that piece of bread is different and slower than your insulin levels that will change a lot slower. Then it will change your blood sugar levels. It changed the way you might gain weight from that piece of bread. So it's understanding how our body work with the same type of food, depending on how we eat them. That's why I recommend that you go for like reading about it and to understand how our body work, and that will make a lifestyle change and not a change in every habit or every dietary habit you ever had. But you just, the way we normally, at least in the United States, we eat the whole loaf of bread before our meal comes, you know, that's completely changed the way our blood sugars rise, and that lead to the, what we call it, the increased weight around the waist, which is a higher risk for diabetes and heart disease and everything else, rather than just our general weight. So these are my recommendations, to be held accountable, find a way to report to someone. And if you want to read one book, it will be the South Beach Diet book.
Thank you so much.
Thank you.
I have one more question for both of you from Rebecca. And I'll start with you, Dr. Kazzaz, because you were just speaking about the diet. And Rebecca would like to know if you are interested, if you would recommend the zone diet for heart disease.
The zone diet. I'm not sure I'm aware of what the zone diet is. That intermittent fasting?
Rebecca, if you'd like to comment in on that. She said no.
What is it about?
Can I try to answer that?
Sure, please.
Oh, please.
It's the blue zones, I think, is what she's talking about, where Sardinia near Italy or Linda Loma, California, the people eat pretty much like a Mediterranean diet type food, and they live to be much older, less heart disease, less arthritis, a lot less disease, and they live longer lives, healthier.
Absolutely. As I mentioned in my speech, Mediterranean diet is one of the most repeatedly proven diet to reduce the risk of cardiovascular events. And what they emphasize on is a lot more fresh fruits and vegetables, a lot more tree nuts, fish, less red meat, less processed food, and all these food has anti-inflammatory properties that reduce the arthritis, prolong life, there is also data about the social aspect of eating the Mediterranean diet in those regions in Italy, because people make the meal as a social event, which will obviously, as Dr. Williams had mentioned, increase those happy hormones, and those lower our blood pressure, lower our stress levels, because that is a very critical point of making meals as, you know, when I visited Italy years ago, they say we know the tourists are Americans because they're eating while they're walking, and they don't sit and celebrate their meal and take the time to do it, you know. And the other recommendation that I heard is chew your water. Take your time, enjoy the meal. So this way you know, it takes about 20 minutes for our stomach to tell our brain that it's full. So if we eat in less than 20 minutes, we're much more likely to overeat. But if we actually slow down and make it a social process, along with, you know, the fact that it's essential for survival, and eat slow and chew our food slowly, we're less likely to overeat. Definitely the food culture, the Mediterranean diet concentrating on the low red meat, the more less dairy also, and more beans and fresh fruits and vegetable, fish and tree nuts are extremely important.
Well, thank you so much for
Thank you.
sharing that information and for answering that question so thoroughly. I've got just one more question, which is, I'll say to both of you offered really helpful resources over the course of tonight. Would you be willing to share those with me so that I could send them on to registrants for tonight?
Sure.
Oh, well, absolutely wonderful. Thank you so much, both Dr. Kazzaz and Dr. Williams. It has been such an illuminating evening with you. We have learned so much from your wisdom, from your expertise, and from your experience. And on behalf of the Y, I just want to say thank you for making this such an incredible kickoff to our 4-part February-long virtual women's speaker series. We've got much more to come up, some really interesting speakers from all different kinds of backgrounds and expertise. And I also just wanted to redirect real quickly that Steph Noble, who is our Director of Marketing and Communications, mentioned in the chat that the Y has a virtual total health program that may be helpful for individuals to make incremental lifestyle changes. So if you are interested in anything that's come up on the chat or anything we've talked about, the YMCA very likely has some programming, most of it virtually accessible because of the pandemic time and also because that's the way that we're going, to be able to connect you to other people, to be able to connect you to yourself, and to connect you to community who are also seeking health and camaraderie in that process. So I suppose without further ado, I'll spotlight myself here so I can say goodbye also as the host. I just want to thank everybody so much for logging on and for coming. Please do come back for the rest of our series. And thank you so much to both of our speakers.
Thank you. Nice meeting everyone. Thank you.